Okay, so on the left column is about disorder or condition. On the right column is about diagnostic test. So if you want to know if a patient has autoimmune or not, you look at the erythrocyte sedimentation rates or ESR. ESR increased, that means they might have autoimmune. Or if the CRP, C-reactive protein increased, or if the rheumatoid factor RF may also affect an anti-nuclear antibody ANA. So autoimmune, ESR, CRP, RF, or ANA. For rheumatoid arthritis, RA, you also look at the above autoimmune test plus anti-citrussinated peptide antibody. So again, for autoimmune or rheumatoid arthritis, you look at ESR, CRP, RF, especially rheumatoid arthritis factor, rheumatoid factor, RF, anti-nuclear antibodies. It's more likely for the lupus. Systemic lupus erythematosus, SLE, you look at ESR, CRP, RF, or anti-nuclear antibody plus anti-single-strand DNA, anti-double-strand DNA. Multiple sclerosis, you look at the magnetic resonance imaging, MRI. Multiple sclerosis, you look at the magnetic resonance imaging, MRI. Anticoagulations and blood disorder, anticoagulation and blood disorder, you look at the anemia. When you look to find out patient has anemia or not, you look at hemoglobin, hematocrit, or red blood cell. All three must decrease. Hemoglobin, hematocrit, or red blood cell. All three of these must decrease. Microcytic or iron deficiency, meaning that their cell size is smaller, or MRC is smaller or decreased. When they decreased less than 80, that is called microcytic or iron deficiency. Most female might have it because of the period. Iron deficiency, microcytic. When you see patient have lower MCV less than 80, you probably have to recommend them to get more iron supplements from food or from over-the-counter. Macrocytic or B12 or folate deficiency, it will increase MCV. That means cell size is larger. MCV is greater than 100. Skilling test. Macrocytic, meaning that their folate is deficiency. When they have deficiency in folate, like in pregnancy, they have to take folate supplement. Actually, for pregnancy, you do have to take folate supplement no matter what. That is the recommendation. for pregnant. But if you're not pregnant and you have MCV over 100, you do have to get folate supplement. B12 deficiency may be due to alcohol, alcoholic maybe, or if you were taking metformin for long term, you might also have to get B12 supplements. Venous thromboembolism VTE, the dimer test marker of fibrinolysis, deep thrombosis, DVT, ultrasound, MRI, pulmonary embolism, pulmonary computed tomographic angiogram, stroke prevention treatment in AFib. Stroke prevention treatment in AFib is CHADS-VAS score. Stroke prevention treatment in AFib, you use CHADS-VAS score. C stands for CHF, H stands for hypertension, A is age over 75, 2 points, D is diabetes, S is stroke, 2 points, previous MI, PAD, etc. V is vascular disease. Vascular disease is PAD, sorry. A is another age between 40 to 74. Sexes must be female in order to get 1 point. And if female get CHADS score at least 3 or more, they have to start oral anticoagulants, rivaroxaban, endoxaban, apixaban, over warfarin. Cardiovascular condition, acute coronary syndrome ACS, you're using ECG or EKG, or troponin, I or T. Arrhythmias, you're using ECG or EKG, Holter monitor. Arrhythmia, you're using ECG or Holter monitor. Heart rate, Holter monitor is a portable ECG device. Holter monitor is a portable ECG device. Holter monitor is a portable ECG device. Acute coronary syndromes, ECG or EKG, you can use it to diagnose acute coronary syndromes. Also, creatinine kinase muscle or brain, CKMB, troponin, you also can use it to diagnose ACS, troponin I or T. Troponin I or T, you can use it to diagnose cerebrovascular accident, CVA or stroke. You can use MRI or CT to diagnose cerebrovascular accident, CVA or stroke. Echocardiogram, echo you can use to diagnose chronic heart failure. Increased B-type natriuretic peptide. cardiac stress test, cardiac stress test, CKMB, troponins, IoT, ECG, angiography, can use to diagnose ischemic heart disease, chronic stable angina, increased TC, non-HDL, LDL, TGs. You can use it to diagnose dyslipidemia. Cardiac stress test. You can use it to diagnose ischemic heart disease or chronic stable angina. Cardiac stress test. You can use it to diagnose ischemic heart disease. Ischemic heart disease or stable angina. Chronic stable angina. Chronic stress test. You can use it to diagnose. Chronic stress test. You can use it to diagnose. Cardiac stress test. You can use it to diagnose chronic stable angina. CHF. You can use echocardiogram or echo. Hypertension. That is easy. Hypertensive emergency. You can look at blood pressure over 180 or 120 with acute target organ damage. With organ damage, you must go to emergency right away. But if it's urgency, you don't have organ damage. Can use ASCVD risk. You use it to diagnose 10-year atherosclerotic cardiovascular risk, disease risk. This use if no history of ASCVD such as ACS, ischemic heart disease, stroke, or PAD. Endocrine conditions. For diabetes or prediabetes, you use fasting plasma glucose or oral glucose tolerance test, OGTT or hemoglobin A1C, OGTT or A1C. Hyperthyroidism, you're using TSH or FT4, free T4, FT4, free T4. So for hypothyroidism, because when you have hypothyroidism, there's a negative feedbacks from the hypothalamus. So the TSH will be increased in the bloodstream in order to increase and then decrease free T4. female have ovulation using luteinizing hormone. Peak value provides optimal timing for intercourse to become pregnant. Pregnancy positive human chorionic gonadotropin in urine or in blood outpatient test kit. Bacterial vaginitis. You can use clear, white, or gray vaginal discharge with fishy odor and pH more than 4.5, little or no pain. So this is bacteria, but this one is Candida. Candida is fungus infection in the vagina, so you'll see thicker vaginal discharge and you will feel itchy. Trichomonas is you will see yellow, green, frothy vagina discharge, soreness, pain with intercourse.